is Professor Catherine Gachutha from Community Anti-Drugs Coalitions of Kenya, CADCKE. And Community Anti-Drugs Coalitions of Kenya brings community actors together so that we can fight against the drug menace. We take care of children and youth. Research tells us that when children and youth, they are prevented from initiating drugs or even developing dependency or even disorders, then even later on in their own life, they are not going to have those kind of difficulties. So coalition work brings community actors together like health, education, religious institutions, even the media, even the parents and the youth and the women, the NGOs, the FBOs, so that we can fight against drug abuse. We try to create drug-free communities, and our focus population is children and youth, so that they don't initiate drugs and develop difficulties later on in their own lives. There was a need for us to work within communities, because it is within communities where drugs are sold, and it is within communities where drugs are used. Because again, we try to change the community conditions or the local conditions so that children and youth do not get addicted or do not use and eventually get addicted to drugs and substances of abuse. The children and youth are the ones that benefit a lot in schools and out of schools. And we have impacted more than 2 million people because we have 8 coalitions within the country. CADCKE is an umbrella body of coalitions within the country. I have written a book on effective parenting in the 21st century, and our coalitions use this book in order to equip the parents so that parents can help the children to live healthier lives. One of our coalitions, Madare Coalition, we had a lot of problems in drug dens. Abandoned houses were being used where young people were going to pack drugs and to transport drugs from there using children. And we partnered with the local administration, the sub-county, and also with the law enforcement officers, and we requested that we can be given bulldozers and other equipments so that we can bring down those abandoned houses. These coalitions within communities, sometimes people expect to be given money or to be remunerated so that they can do the work. But from the onset, when we are initiating a coalition and we get the community contact persons, we remind them that we are looking for frontiers, and they are the ones who are going to tell us how many days they can frontier within a month, so that people are not so expectant. So what we do is to make the people realize that they are going to be working as frontiers and that they are going to be giving back to the community. So that challenge, we have been able to handle it in that way. We also get our funding from people who want to give us like charity, or they would want to give us resources so that we can continue with the work. And sometimes we can even be given a hall where we are going to be meeting, and therefore we receive those resources that we can be given in kind. And also the frontierism is the giving of resources so that those resources can be able to transform our communities. In 5 years to come, we would want to be in 20 counties in the country, because we have realized once we establish a coalition, then that coalition can establish other coalitions within other sub-counties within a county. So we see ourselves at a point where we will have more than 20 counties where we have set up coalitions in the country. It's a big thing that drug abuse is being seen as a public health issue, and we can bring together community actors so that we can fight against the drug abuse. If it is a chief, the chief is saying, we do not want Mogoka to be brought to our place because it is destroying our children. So this organization that brings community actors together is an organization that needs to be taken forward, and therefore I would want to be an alumni because of the great work that we are doing in changing and transforming communities. The current coalitions, which are 8 coalitions within the country, all these committees, most of them are led by women. So we are breaking the barriers because we have seen that women can really be passionate with community work, and therefore we've been involving women to make changes within communities so that we can take care of our children and youth so that they don't get destroyed by the drug menace.